So we've got a nice afternoon. Thought we'd get outside and do a video about penetrating chest injuries. So for demonstration purposes, I'm not wearing my gloves. We have a chest cavity with a 9mm bullet wound through it. First thing we got to do is seal up this wound. So we're going to take a chest seal of some type, like a hyphen vent, open it. We're going to take the hyphen vent out of the seal, take our 4x4s from it, wipe off any excess blood or body fluid that we have on this chest cavity. Take the chest seal in my hand with the sticky side up. You can see the vented areas to allow air to escape but no air to come in. I want this directly over the bullet wound. So I take firm pressure just like that, and then the wound is sealed up. You can see the vent channels that'll let air escape, but air cannot come back into the wound. For small wounds like this, you can also use something like a tegaderm so that it will seal the wound up. The only thing about the tegaderms is they're non-vented. So once I seal this wound and take this off, if pressure builds up inside the chest, you may have to lift a corner to release that pressure every so often. Now we'll talk about if we don't have chest seals, something that we used to do back in the day before all these commercial chest seals were on the market, then it was simply Vaseline gauze. And the way that we would use these is open the gauze just like this, pull the gauze out, throw the gauze away, and we'd actually use the wrapper, put it down over the wound, sealing it off. If it's a smaller wound, I could actually peel the back off and leave this here. The Vaseline helps it stick to the skin. Then I take tape and I tape it down 3 sides and leave a corner open. That way, if air pressure builds up in the chest cavity, it can vent the air pressure to the outside. Now, remember, with penetrating chest injury, typically you'll have a wound in the front and a wound in the rear. So the process that we did with this on the front of the chest, if there is an exit wound or another injury site on the back, you're going to have to roll the patient up on their side and do the same for that hole that's in the back. So after you have the chest seal on, you have to worry about pressure building up inside the chest and the lung possibly collapsing. If you're trained to do so, you can use a chest needle and do a needle decompression of the chest. For your landmarks to do this, it's going to be the second intercostal space, which if you find your clavicle or your collarbone, feel, and you'll feel a notch below that. That's going to be the second intercostal. The first intercostal is actually below or underneath the clavicle. So when I find that, I'm going to insert my needle in that second intercostal space just above the third rib. Or an easier way to find it on an adult, you can take your finger, put it in the notch at the top of the sternum, spread your thumb out, and your thumb is actually going to go in that intercostal space where you're going to put that chest decompression needle. Now we'll talk about chest decompression. If the lung is actually collapsed inside from the hole that went through the chest wall and penetrated the lung. So we take our 3 1/4 ARS chest decompression needle, find your landmarks, feel between the ribs, and it takes pretty firm pressure to fill that intercostal space between these 2 ribs. Then we're going to take our needle, just like this. There's our 3 1/4 needle. Take it, and when I insert it into the chest, we've got to go above that rib. I insert it. There's a little bit of pressure because this intercostal tissue, it can be a little bit fibrous. And I'll feel it go down into the chest cavity. Once it goes down into the chest cavity, then you insert the catheter and withdraw the needle. The catheter will go down to here, and you're actually going to leave this just open to air to let this vent out. Now, what this actually looks like on the inside of the chest is you will be left with this needle or this catheter that is inside the chest cavity. And when that lung reinflates, it will just bend this catheter and kink it so that it's going to actually get obstructed. And if that's the case, this may need repeated again if that pressure builds up inside the chest. And there you have it, a short video on chest seals and needle decompression.